I'm a disabled woman myself, and I've had three children. One passed away, unfortunately, not long after she was born, and I have two adult sons. So a lot of my own passion and interest in sexual and reproductive health rights and mothering, pregnancy, and such came out of my own personal experience and my activism, hearing from other women and girls what they were experiencing through their access to healthcare and education around this. So I've really been passionate about this conversation for a long time, recognizing, that women, especially girls growing up with disabilities, are sometimes segregated from access to information and education. Women who have disabilities experience challenges accessing appropriate healthcare. So long ago, it just kept coming up in other work I was doing. And so specifically, I became an expert in monitoring human rights. And with my interest in sexual and reproductive health rights, I developed some workshops that were for people with disabilities to understand their rights, especially under the Convention of the Rights of Persons with Disabilities, and within the Canadian context, which is where I live. So that was one of the areas that I did. I also did a little bit of work with Disabled Women's Network of Canada around sexual and reproductive health rights, looking at access to information. We don't necessarily have forced sterilization in Canada, but we have coerced sterilization. So women with disabilities and girls with disabilities are often sort of scared into getting their tubes tied or being on long-term suppressants to become pregnant. I've also recently completed my PhD, and I interviewed disabled mothers across their lifespan. And so a lot of my research and my questions to participants was around, what was it like growing up with a disability? Did you have access to information about your sexual and reproductive health? What was it like being a young person making decisions about becoming a parent? Were people accommodating to your disability? Did doctors know about your disability and how to support you if you decided to have children of your own physical body? And I've also done a number of projects where I've been brought in as an expert in the intersection of sexual and reproductive health rights and disability. So very recently, I was part of the Canadian Beijing Action Platform for Canada, which was supported by CREA and really looked at Canada's, what Canada needs to do better in the specific areas that the Beijing 25 Plus had identified. We know that approximately 1 billion people in the world live with a disability. In Canada, it's 22% of our population. So if you think about 50% of that are women or girls with disabilities, it's a pretty great need. And it's an area that is really neglected. So for just the numbers, I think a lot more work needs to be done to really understand what are the needs of disabled women and girls, what access to information do they require, specifically looking at cross-disability needs. So sometimes in my research, I've learned physical access might be accommodated. So if you're a wheelchair user or if you use a mobility device, there are some clinics that are available for women in Canada, but often other disabilities are not accommodated. Specifically, people who are deaf or hard of hearing. I think there's a huge gap in accessing appropriate care for that population. People with communication disabilities are not often supported, and especially, I've heard from some folks that sometimes they're not given the words to talk about things in communication boards or in the language that they're taught that's not part of the general language and language you might learn from your peers. So I think it's a really critical area. And one of the things I heard from participants in my PhD study was they just weren't given information about how pregnancy might impact their bodies, or how different kinds of birth control might be affected by medications that they might be on long-term, or even just affect their disability. And as I said, there is a real lack of accessible healthcare, and women with disabilities and girls with disabilities continue to face barriers, attitudinal barriers to accessing appropriate information in healthcare. I think that the first reason is safety. Women need information about their bodies. Women with disabilities and girls with disabilities experience some of the highest sexual violence and rape and molestation, and without appropriate information, first of all, they don't know how to deal with that, or they might become pregnant without planning to be pregnant. Also childbirth should be one of the most exciting moments in a woman's life. I mean, becoming a mother, for me personally, I lost a child, and I also have two sons who are now adults. But that moment of becoming a parent was really amazing and important. And what I heard from the participants, especially in my research study, but also my friends and colleagues who are activists and who are parents, is too often, because of, inappropriate care, inaccessible care, attitudinal barriers, that women actually experience their pregnancies and childbirth as traumatic events. And it takes them a long time to recover from that. So I think that it's really important that professionals understand and support women with dignity and respect. And I know, I'm a strong believer that we're all raised in this world with certain attitudes, growing up. And I think it's really important that healthcare professionals confront ableist ideas they have and eugenics ideas that they have internalized without maybe even realizing. I mean, many of us were like, oh, I'm really inclusive, but then, we're confronted with something different and outside of our perspective. And it's sometimes not easy to really, walk with what you're feeling, work through what you're feeling, because it's not about the person you're supporting as a healthcare professional, and come to the other side and treat that person, as a full citizen with dignity and respect and kindness. I also think it's really important that health professionals are not afraid of people with disabilities. We live in our bodies full time. And if we've gotten to the place of becoming a parent, especially if we chose to be a parent, being afraid of treating us is not very helpful. And there's been some studies that have demonstrated that doctors really are afraid to treat people with disabilities. They assume complications that aren't there, or they don't have enough information to actually, feel confident in supporting them. And so I just think it's really important that our health system and our healthcare providers examine their own ableist ideas. First thing is education. And building on what I just said around, looking at our own internalized ideas and assumptions about disability. I think anti-ableism training is really important. Unconscious bias training is really important. And then understanding the intersections of ableism with other populations, such as racism, or in Canada, colonialism, which has a very long history of how Canadian people in positions of power treat Indigenous populations. I think that exposure to different types of people is really important. We know that the younger people coming up out of our education systems, where students with disabilities attended classes with their peers instead of being segregated, we know that they have stronger community bonds. We know that young people going into, their education to maybe become healthcare professionals had friends with disabilities growing up. So I think that that's a really important thing, and an aspect of community. I think it's important that there's a belief that people with disabilities know our own bodies. And so, if we think something's not okay, it's we know our bodies better than anyone else. Respect and dignity is really important. I've repeatedly heard about how devastating it is to be disrespected, or the things that women with disabilities overhear that professionals talk about them and their bodies. And I also think it's really important to know where resources are. So know where you're, who would you call on for sign language interpretation if you were supporting a woman or a family that were deaf and use sign language. Be prepared to use really creative solutions and be respectful of personal support workers who women might employ to help them to go about their daily living. And finally, I think it's really important to audit your spaces for accessibility. And not just physical accessibility, but also thinking about people with low vision and people who are blind, and how would they navigate the spaces where you meet with your patients or clients. Think about the information you're sharing, and is it accessible for your patient if they have a learning disability, or such as dyslexia or any kind of processing disability. Think about if you have a patient with autism and what kind of environment you're bringing them into, and will they be comfortable and able to be calm in that space? And really ask women what they need. I think that that's often forgotten. There's assumptions that the professional knows everything instead of letting the patient lead the experience. I mean, the obvious one is the embodied experience. Living in a disabled body, we experience the world differently, whether it's, if we can, how we see things or do not see things, how we interact physically with the space, hearing or not hearing, I think is really important. There's a lot of, I think there's a lot of leaning on people being able to hear in the delivery process. It gets pretty intense. And I think it's important to think about the differences that might be experienced for someone who has hearing loss or who is deaf. There's also very much how disability intersects with the pregnant body. So I had a number of my participants talk about, their mobility devices or braces for their legs or their body didn't work for them when they were pregnant because your whole body mass shifts. And one woman talked about, being in her wheelchair that she no longer really fit in. And in Canada, of course, many of our cities, we have a lot of snow. And she talked about feeling like she was going to topple out of her wheelchair because when she's not pregnant, most of her weight's in her bottom. But when she was pregnant, it was very front end. And so, being aware of those kinds of things is really important. And it's one of those differences that if, you're supporting a woman, you can prepare her for that. I also, I want to just amplify again the communication differences that might exist, that include things like sign language, that people with disabilities sometimes have personal support workers with them. And it's not the personal support worker's job to do everything. They're usually hired for specific tasks. Know how to communicate with a person with a disability. Speak to the person. Don't speak to their support worker or their interpreter. Don't interact with service animals, I think is really important. People too often don't understand the parameters around that. And I think it's really one of the biggest differences, or one of the things I really want to highlight, is that know about potential risks for a pregnant person who has a disability, but stick to the facts. One of the clearest things that I heard is that because healthcare workers didn't know how pregnancy would impact a woman's body, they made up things. I guess I can't think of any other way. For example, girls are told, oh, you'll never be able to get pregnant, which wasn't true. And so a couple of my participants talked about having unexpected pregnancies because they were given misinformation. Some women were told that they, couldn't carry a baby, or that it might kill them, and it wasn't true. And so this fear mongering when you don't have enough information, I think it's really important to address. Another factor is know what the disability is. So one of the oddest things that I heard from participants was that they would go into a healthcare provider's office and there's two things wrong with this, but they would be told things like, aren't you afraid of passing your disability on to your child? The first thing is, this is very eugenics. it's assuming that the worst thing that can possibly happen is live with a disability, which I don't actually think. And the second thing is, lots of times this was said to women who didn't have a genetic condition. So, you know, cerebral palsy caused by an injury when you're being born is not genetic. And I think it's very critical that this difference be known and also respected, that the things that come out of your mouth, they resonate, and women carry those for many years afterwards. Get comfortable with difference. You know, I was on a recent, so at one of my main parts of my disability is I have a mild form of spina bifida, but I have scoliosis. So I was on a information session the other day because I'm curious to learn a little bit more about it. And the doctor was talking about how no body is actually like what the textbooks show you. And so I think keep that in mind, even if our bodies look different or if we communicate different, it shouldn't scare you, right? So get used to difference. If you want to embrace being really inclusive, it's important to sit with your own feelings and not project them on your patients or clients. Be really respectful that just because we do things differently, it looks different to how you might do it with your able body. Don't assume that it's wrong or that it's dangerous. So, you know, I interviewed participants who had various kinds of, some of them had mobility disabilities or limb loss. And they talked about how they navigate the world and some of the assumptions around how that looked, that, you know, how you may cradle your child if you're breastfeeding, or how you change a diaper, or the support you might need. And so I heard two things. First of all, don't assume I can't do it, but also don't assume I can. I might need creative ways to do all of the other things because parenting might be new for that person. Really confront your own ableism and unconscious bias. I just can't say that enough. So many things that come out of people's mouths are because they have assumptions about disabilities that are not based in reality. And get educated, as I said, on the disability that the woman you're treating has. Ask questions respectfully, and really listen, because, you know, we're willing to share what we know about our bodies, but if it's disrespectful, it's really hurtful. And also, I would really say, know what is accessible about your practice. So don't offer to support women you can't support. If your examination space is not accessible for somebody who is paralyzed, don't say that you're fully accessible. Be specific about what you have available. Be specific on what resources exist in your community. If there's no ASL interpretation, American Sign Language interpretation, for example, in Canada, in your community, don't suggest that you can offer that to a woman in labor. I have a lot for the advice, actually. Get creative about labor and delivery solutions. So women talked about going into labor and delivery rooms and not being given options just because they lived with a disability. And yet, you know, like one talked about, I really wanted to go in the shower and figure out how to use that space and water, but they were too afraid because my body has spasms, and so they didn't let me. I think it's really important to listen to women and think ahead about how can we creatively support women. The other thing I heard was sometimes women would be promised things and then they would get to their labor and delivery and not have that supported in the room. And it was more disappointing to be told you could and then not be able to than if they had just upfront been honest and said, I don't feel comfortable supporting you in that space. Don't ask support workers, personal support workers, to do things outside of what their job is, just like you wouldn't ask a doula to do a midwife's job or a doula to do anesthetist, I can never say that word, job. Don't ask a personal support worker, you know, to do toileting or other things that would not be their job normally. And be respectful of their time. They're actually paid, and the woman that you're supporting is paying that person. So being disrespectful of the time actually costs, you know, people with disabilities money. And one of my biggest things, I always say, is try to learn some of your keywords in sign language that you need to use, especially during labor and delivery. You know, that's a very close space. And I remember when I was giving birth, how important my communication with the physician who delivered my children, how important that space was. And when you're trying to deliver and you're distracted, it's complicated. And so, you know, if you think you might be supporting deaf women, take the time to learn some of the key phrases and words that you're going to need.